In this poster, I present a rare case of methemoglobinemia from over-the-counter Vagisil cream. The case surrounds a 50-year-old woman who presented to the ER with skin discoloration. The day prior, she noticed that her lips and fingertips were turning purple. She went to her primary care physician that morning, who did pulse oximetry showing an oxygen saturation of 84%, and sent her to the ER for further evaluation. On admission, vital signs were normal aside from an oxygen saturation of 89% on room air. She denied shortness of breath, recent travel, chest pain, lower extremity swelling, fever, or chills. Aside from the skin discoloration, her only acute complaint was vaginal itching. The patient was admitted 2 months prior for diverticulitis. During that admission, she was treated with metronidazole and ceftonir. She subsequently developed severe chronic vaginal itching believed to be attributed to her recent antibiotic use. She had been using Vagisil cream 5 times a day over the past 3 weeks. Note that this was significantly more than the manufacturer's recommendation to apply the cream for a maximum of 3 times a day for up to 1 week. Her laboratory values were most significant for a respiratory alkalosis on 15 liters of oxygen on a non-rebreather, and a methemoglobin value of greater than 28%. The diagnosis of methemoglobinemia was made, and the patient was treated with methylene blue. Over the next few hours, she was closely observed, and her symptoms and laboratory values normalized. She was watched overnight in the hospital and was discharged the following day. During normal human physiology, methemoglobin makes up less than 1% of the hemoglobin in the body. Built-in mechanisms both protect against and reduce the effects of oxidative damage on red blood cells. The major pathway uses cytochrome B5 reductase, which reduces 95 to 99% of the methemoglobin produced. Disruption of this enzyme, or when the oxidative burden overwhelms the cellular capability for reduction, induces methemoglobinemia. Oxidative stressors, such as benzocaine, which is found in many over-the-counter products including Vagisil, leads to removal of an electron from the ferrous hemoglobin to create the ferric methemoglobin. As methemoglobin accumulates with repeated applications, the rate of methemoglobin accumulation surpasses the endogenous mechanisms built in to reduce it. Methemoglobin has an increased affinity for oxygen. This leads to an overall reduced ability of the red blood cells to release oxygen to tissues, shifting the oxygen-hemoglobin dissociation curve to the left, creating the typical signs of methemoglobinemia such as shortness of breath, cyanosis, and fatigue. Benzocaine is found in many over-the-counter products such as Aspercreme, Oragel, Biofreeze, and many other products. While cases of methemoglobinemia have been reported with some of these products, this case is particularly unique because of the mechanism of delivery. Oragel, for example, is a product applied to the oral mucosa to relieve tooth and gum irritation. Systemic absorption through the oral mucosa is generally quite good. In fact, we administer many medications sublingually, such as nitroglycerin, for its fast systemic absorption. Contrast this with the vaginal mucosa, where systemic absorption is quite poor. There are many factors that affect systemic absorption, such as the thickness of the epithelial layer, as well as the volume, viscosity, and pH of the vaginal fluid. During the menstrual cycle, the epithelial thickens by 200 to 300 micrometers, further decreasing absorption. For these reasons, systemic absorption is not considered a major contributing factor, making this case of methemoglobinemia from an over-the-counter medication particularly unique. While there have been a number of reported cases of methemoglobinemia from over-the-counter medications, there have only been 2 reported cases of methemoglobinemia from Vagisil cream. Both of these reported cases occurred in infants. This is the first reported case in the world of methemoglobinemia induced by Vagisil cream in a perimenopausal woman. During menopause, the amount of fluid produced is reduced by as much as 50% compared to a woman of reproductive age. Additionally, the thinning of the vaginal epithelium, which occurs during menopause, may make systemic absorption more likely. Studies have shown that absorption of estrogen, as well as steroids administered vaginally, have been shown to be higher in postmenopausal women. While more studies need to be done, it's quite possible that the patient's perimenopausal status increased her susceptibility to developing methemoglobinemia. As there are many over-the-counter medications that contain benzocaine and other oxidizing agents, while rare, when other risk factors are not present, physicians should consider these over-the-counter medications as a source of methemoglobinemia. Finally, while the instructions to apply up to 3 times a day is listed on the outside of the product packaging, the duration of use, as well as the adverse reaction of methemoglobinemia, is only listed on the manufacturer's website. While methemoglobinemia is a rare complication, companies should consider making this information available on the product packaging, as well as making instructions easily accessible.